Want to run faster, longer, and safer? Are you thinking about buying a new pair of high-quality running shoes? Or planning for a gait analysis in order to lower the chance of getting injury? Before you spend the money, let's go back to basic, your foot, the foundation. Train your foot core system. Practically speaking, strengthening foot core system is not only for overpronation related injuries, but it also benefits runners who sustain a long-term lower limb injury, in which the performance may be affected due to unable to follow training plan. However, patients often find it very challenging to perform these exercises. They can't figure out how to activate them, end up with trick movements. NMES stimulation educates patients to understand the precise activation of the IMF. The neural, active, and passive subsystems interact to produce the foot core system, which provides stability on dynamic environment. NMES works on the neural and active subsystem by waking up those sleeping intrinsic muscles, educating patients to understand the precise involuntary activation of the IMF rather than trying to figure out how to do it themselves. Several research shows that the effect of a single NMES treatment lasted 2 months, so it should be more on the neural subsystem. With NMES, they can progress to short foot exercise. You have isolate contraction of the plantar intrinsic muscles as the arch is elevated, the foot domain. Patients compensate by using mainly extrinsic muscles. After trained with NMES, patient learned to use more intrinsic foot muscles, less dependent on the global muscles to create the arch, less compensation. The body core strengthening is well known and well implemented in clinical practice for effective limbs and functional movements. This concept also applies on the foot, and its stability is responsible for better lower limb biomechanics. According to McKeown et al. From Swiss Olympic Medical Center, intrinsic foot muscles strengthening using NMES enhances foot postural control. 4 weeks of training improve both local foot postural control as well as dynamic single leg balance. This is recommended to be integrated in any lower limb injury prevention program or strengthening and conditioning plan program.